let's discuss what could happen if we incorrectly position our patient's body. So to accurately access the blood flow in an extremity, the influence of the gravity must be eliminated. But how? It could be done by accurately positioning the patient's body and his or her extremity that is being measured for blood pressure. The patient should be seated upright and the extremity should be at the level of the heart. Why? Because if it is below the level of the heart, the blood pressure recorded will be falsely low, and if it is above the level of the heart, the blood pressure recorded will be falsely high.